Dr. Thomas Romo, and welcome to our office. Coming to New York over 20 years ago, I joined the New York Eye and Ear Infirmary, and everybody in plastic surgery is always interested in treating cleft lips and cleft palates. And here was the oldest specialty clinic in the United States for 175 years, and there were children who were in the clinic who had no ears. No one really knew how to treat that. The current data at the time, which is still the standard in the world today, is to take children, and in order to build them an ear, you have to have a framework. And the standard framework, which is used today around the world, is to take children and cut their chest and take out a piece of rib cartilage the size of an ear, which is a pretty big structure, and carve that, which I liked, into the shape of an ear and put that on the side of their head. And that would then produce an ear over 3 or 4 operations. The problem is that it takes a tremendous artistic capability. It also takes a lot of trauma. There's a lot of morbidity to that for me, looking at a 6, 7-year-old little girl whose chest is only this big, and you're going to take out a piece of rib this big. That process I didn't like, and I actually did that type of surgery for 10 years using the rib cartilage. About 1 in every 5,000 children are born with no ear on one side, and they have no ear canal, therefore they have no hearing. In 1993, I was introduced to a new type of material called porous polyethylene. It's a porous plastic, and I read about a guy who was building ears using this porous plastic out at USC for men with their ears burned off after fires. And I said to him, it's outstanding that we don't have to cut their chests anymore. Could you use that in pediatric ear reconstruction for children? And he said, I guess you could. So in 1993, I started and developed an operation for building ears for kids born without ears. And like all things in New York, it started off very small, and now we have children coming from all around the world. The operation limits the amount of surgery. They go home in 1 day. We get it done in 2 surgeries. And it profoundly changes these children's lives. When you see a child like this who doesn't have an ear, obviously they have a hearing deficit, which is profound, and if it's bilateral, it's significantly profound. So we envelop these kids. It's really important to educate the parents. It is incredible to me, being the father of 3 kids, that the day your child is born, it's supposed to be the happiest day of your life, I guess, besides your wedding. The happiest day of your life. And here you are, the child is born, and the nurses and the mothers describe this to me, that everyone's quiet. And obviously there's something going on. And they end up presenting the baby, and the baby has a birth defect. It's imperative that the physicians there, number one, are knowledgeable enough to know that they can empower the family, saying something can be done. And something can be done that's not too invasive and that will help this child. Additionally, I think it's very important for those physicians to not set up a situation where they tell the mother maybe it was something she did during the pregnancy that caused this. That guilt, which brings in, these mothers come in and tell me that the doctor said it was something I drank or something that I took. I just think that's horrific. These are spontaneous birth defects. Luckily, we can do something about that today. And doing something about that, which is very interesting, when you see these children, when we've done the first operation and we've built them an ear, and you take off that dressing and they see themselves, and you see them go up into a mirror, and you see them looking at themselves, and they have 2 ears on their head, and you see this big smile, and then you see the mother smile and crying. It is quite an event. Usually the whole room is crying as well. There is another activity with the hearing loss. I mean, these children don't have an ear canal and an eardrum. And there is a new device called a bone-anchored hearing aid, which we also supply for these children. And to have these children take that bone-anchored hearing aid with a band before they've been installed and turn it on and watch their big smile and watch them smile and watch the parents smile now that they're hearing for the first time, it is really incredibly, and it's life-altering. It is going to empower them, and I think that I am blessed to have the ability to provide this service for the children, because it's all about the children it's not about us.